Practitioners here to perform minimally invasive pain management procedures, and she can share the real thing with you.
Mr. Lyons shared so much with us earlier, and it's really an honor and privilege to be able to talk with you and for the viewers to have a chance to see you and tell us a little bit more about what you're doing here.
Over here, mostly we'll be dealing with invasive pain management techniques, which in a non-hospital setting, which will be very comfortable for the patients. It'll be easy access and comfortable for the patients to come in and out.
Yeah, I've noticed coming here, it's so nice. All the, no matter what building you're going in, the doors are automatic, it's wheelchair accessible, every room is decorated, so pleasant. I just walk in and I see all the new construction, and it just has such a peaceful, serenity type feeling. That's really nice.
This will be the first in Western New York area. I think even in New York State, it is one of the very. There are two in New York State.
There's only one other that's open that we're aware of. It's in Syracuse.
Wow.
We visited the facility. It's very nice, and this is very similar to that.
Wow.
Approved by the Department of Health. Pain management is also done in multi-specialty centers, but this is will be, to our knowledge, the second one in the state that is a single specialty freestanding ambulatory surgery center approved by the state of New York.
And what kind of things are being done over here?
We usually use the X-ray machine to do most of our procedures because it is more precise. We know exactly where we are putting the needles. This is a C-arm, so we take pictures in several angles, so we know exactly where the needle is being placed. And this is the fluoro where we can see where the picture is, then we can explain.
Oh, instantly, you just see it.
We are seeing it while we are doing it.
State of the art, once again.
And that way, we can explain to the patient at the end what we did.
Wow.
And it is, and most patients are awake. So it's pretty easy and in and out procedure.
And so what type of, because when people are watching right now too, what types of injuries, because like you're explaining all the injuries because you know them and you say a whole bunch of things, but somebody might be watching right now and have some kind of injury and not realize it's for them too. So tell me more about some of the injuries, some of the people who would want to get in touch with you to learn more about these procedures.
Most common are neck pain, mostly with accidents, neck, back pain, it can be cancer pain.
Really?
Headaches, injury to the arm, leg.
So even like what if you have a broken bone, that kind of injury as well?
We're talking more about chronic pain here.
Okay.
But if acute injuries, we may be able to deal with it, but mostly we deal with chronic pain.
And tell me more about the headaches.
Headaches, there are different reasons why people have headaches. Sometimes even with a car accident, with injury to the neck, they can get headaches. So first we need to diagnose why they have a headache. And then depending on that, then we can do procedures. There are different types of procedures we do for that. Some facet injections, phenopalatine, ganglion blocks, all sort of, but first we have to diagnose what is going on.
Right.
And then we decide what is needed.
You said something else too when you were listing the different things that made me think of a question. Go back again. You said the back. Oh, cancer.
Cancer, yes.
Cancer. I'm thinking, what do you do for cancer patients? I would have, see, that's what I mean. If somebody watching may have cancer and think you're just talking about back and neck injuries. So how does cancer fit into this?
Pancreatic cancer is a very painful condition. And even a lot of narcotics don't really take care of the pain. And there is a block we can do where we inject phenol or alcohol and we destroy some nerves, which decreases the pain from the pancreatic cancer. And most of the patients don't have long to live by the time they're diagnosed. And we can at least control their pain halfway, or so their need for narcotics goes down. And so quality of life improves.
Wow.
So,
and what kind of results have you seen with people once they've come off of these pain medicines and had these treatments? what kind of feedback are you getting? I can just imagine.
No, I get excellent feedback. You know, they get back into life. They get back, some go back to work. I have a couple of patients, you know, with the spinal cord stimulator, with morphine pump, which they had totally given up. And now they're employed.
Wow.
You know, things like that. We want to get them back into the workforce, get them to have their own identity. It is unbelievable how they feel when they have to depend on other people.
Wow.
So,
I can only imagine. As I said, my accident had to go through a lot to get where I am today, but I kept pushing through all the pain, and I wish you were here where were you 4 years ago?
I was here.
Well, I'm just really grateful that this is right here in the downtown, the heart of the downtown area, with plenty of parking, with easy access for wheelchair and on crutches. And that's a big thing, because if you have to park somewhere far and then try to get to the facility, by the time you get there, you're probably ready to take more pain medication, right? So this is a great place right behind Western New York Imaging Group. Their address is 222 Genesee, and your address is Michigan Street, right?
700 Michigan. We're both pretty much at the corner of Genesee and Michigan, right at the base of the 33, very easy to get to from all parts of Western New York.
That's pretty cool. And we had another doctor who was trying to be here, who was?
Dr. Wagmarie, also an anesthesiologist and a specialist in pain management, and one of our primary practitioners who will be scheduling patients here as well.
So we'll definitely come back so that we can interview him too. And Doctor, I just want to thank you for taking time out of your busy schedule. It once again speaks to the commitment to the community to come and to share this information so people have information, and we know that information brings you power only if you act on it. So thank you both so much, and much success to you. And I hope I don't need your services anytime soon. So thank you for watching. We really appreciate your emails and letting us know that you like all the programs that we're bringing you. We want to know if you want to be interviewed on this program too, so keep those emails coming. And we have a couple more sponsors to thank. We want to thank Mr. Frank's Barbershop and Beauty Salon. Yeah, you heard me, Barbershop and Beauty Salon.
Wow.
This used to be her dad. She's been there forever. And then she became a beautician, and now her father has since passed, and she stays there on that corner, providing all kinds of services and educating people on hair care, and she does medical pedicures. So as you start to get when you start to get a little older and you can't get down there to take care of what needs to be taken care of, there's ways you can do it.
Wow, that's neat. Wow. Also, the Healing Spa with Marge Reed offers holistic, non-surgical facelifts, facial chakra balancing, color and light therapy, and many other therapies, helping to bring the body into balance wherever it is needed.
So keep watching, keep emailing us, and stay focused, because
your health matters.
See you next time.